Hi everyone, my name is Laura Kays and I am in the Advanced Clinical Practice track, and I'll be presenting my final project, and the title of my project is Evaluation of Gaps in Financial Feasibility of Accreditation at an Integrated Health System Specialty Pharmacy. At the time the project was assigned to me, I was working or doing my rotation at Credina Specialty Pharmacy, and they were going through the process of renewing their accreditation with URAC, which is the Utilization Review Accreditation Commission. And URAC is kind of the gold standard for specialty pharmacy accreditation. But currently, the standard of practice is shifting towards holding dual accreditation, and that's with URAC as well as ACHC, which is the Accreditation Commission for Healthcare. So the project manager and I were completing this project to assess the feasibility of them becoming accredited with ACHC. And holding this accreditation can open up many financial opportunities for specialty pharmacies. So overall, there were two main outcomes that we were looking at. First was to evaluate, assess the current policies and procedures and evaluate for any gaps that were present. And a gap basically refers to a space between where the organization is, so their current policies and procedures, and where it needs to be, which is meeting the ACHC standards. So seeing what was missing within the current policies and procedures. And we categorize these gaps as being staff training, information gathering, so things we needed to dig it, a little deeper into the policies and procedures for to find information, and then also policy updates and procedure and workflow updates. An information gap is technically, we considered it to be a potential gap. So at the time that I completed the project, we still hadn't narrowed down and found the information, so we kind of left it there as a potential gap. We kind of kept a running list to address in the future. And then our second outcome of this project was to assess the cost of becoming accredited to any estimated revenue that would be gained after becoming accredited. And we looked specifically at non-340B revenue. So I had mentioned that the standard of care is shifting towards holding dual accreditation. And many managed care Medicare plans will require that specialty pharmacies hold this dual accreditation in order to participate in their specialty network. Getting into some of the results, so we identified 17 total gaps during the analysis, looking through our policies and procedures, comparing them to the ACHC standards, none of which required any additional staff training. 4 of the gaps were those information gathering or potential gaps. 3 required workflow updates, and then 9 of them required policy updates. And then just of note, these policy updates were very minimal updates that were needed. Many of them were adding in a time frame, so this, including this is done every 5 years or this is done every 3 years. And then many of them were also adding in the verbiage per ACHC standards. Current procedures referenced the URAC standards, so just adding in that second kind of dual accreditation phrasing to the policies and procedures is what was needed. And then the ACHC standards are broken up into several different sections, and 65% of the gaps that we found or identified fell into the quality outcomes and risk management sections of the standards. 29% were those information or potential gaps, and then 18% required workflow or procedure updates. And then getting into the secondary outcome, which is that cost comparison for ACHC accreditation versus potential revenue. And the cost to become accredited is $20,000, but this is renewed every 3 years, not an annual thing. And we estimated an annual non-340B revenue with accreditation based on current therapeutic categories, average prescription counts, and dispenses within each therapeutic category. And then we estimated a revenue per dispense. And we did that kind of an overall average and then per category. The potential non-340B revenue was about $4.7 million, and that was annually. And then we averaged a dispense. The average dispense was about $448, and this is after lumping all the therapeutic categories together. And then we further estimated that about 15 dispenses would need to be fulfilled on an annual basis in order to make up that cost of ACHC accreditation. So overall, final conclusion was that becoming accredited with ACHC was feasible for Credina and would provide a pretty significant financial opportunity for them. And that's really all I have for you. Thank you all for your time and for listening to my presentation. If you have any questions, please let me know.